Good afternoon or good evening, depending on where you are, and welcome to Dr. Robyn's White Medical Minute Monday here on She Is Still Dope Society. It is a pleasure to be with you this evening. I don't know if you all had a chance to log in during the global prayer protest that She Is Still Dope put on over the last 24 hours. It wrapped up around 12 o'clock today. It was amazing, amazing. Women across the globe were able to tune in and pray for 24 hours for any need, anything that was met, any need that was met. We were able to log in and pray. So I just want to give a shout out to She Is Still Dope Society for doing something different and protesting in a different way with our prayers. As we talked about last week, prayer changes things. So going into this week, I really want to discuss COVID-19. And the title of today's topic of conversation is COVID-19 has not gone away. Just because things are reopening, COVID-19 is still alive. So the flu, the virus, just like the virus that comes around every year, it's still here. And so today I was just going to bring up some topics from the CDC website about the coronavirus. They came out today and they realized that there's 130,000 more deaths that they are predicting to happen by July 4th. Because every state that's opening, we're seeing a little bit of a rise in the cases. And let's just think this through on a real basic level. We already know that the virus spreads, right? I'm sure most people have either witnessed a loved one or someone close to them that has either passed away from the virus or has been affected with the virus. So that virus is only carried through people. It's only carried if it's left on a surface. And so in a real basic way of thinking about this, we have to ensure that we are still doing the right thing to protect ourselves against this virus. And it remains the best way to protect yourself against the coronavirus is by wearing a mask. I know I got 4 or 5 or 7 different calls this week. Like, do we really have to wear a mask? That's old news. That's fake news. I don't think wearing a mask really works. And I really just want you to close your mind and really think about what a mask would do. Why would you wear a mask? And what is the reason? Well, remember, one thing about the coronavirus is that some people can carry it and don't know that they have it. Or some people haven't developed symptoms yet. And we know, as we've discussed many moons back, is that because you don't have symptoms doesn't mean that you don't have it. And sometimes the symptoms come at least 5 to 7 days after the transmission or the infection occurs in your body. So we wear masks because we just don't know who has it and who doesn't. So we want to make sure that we're still protecting ourselves. So the CDC says that more cities and states are reporting an increase in the new coronavirus per day. Nationwide, there's a total number of cases that's past 2 million this week. Two of the reasons why we are seeing the number increase, one is because we have more testing sites, so we have more places to go to get tested. And two, we have more contact time because now that we're reopening America, we are in contact with more people. Here in California, a lot of people are excited because the nail shop is opening. I would just caution yourself to know that doing your nails, if you have them up near your face, you're not really establishing that 6-foot distance, which we know has been studied, that 6 feet apart is where you decrease your chances of getting the virus because how far droplets can go while you're speaking. I was doing a presentation on Sunday, and as I got excited, I noticed that I started to spit when I talk. How many of you have seen your spit go out when you're talking? Sometimes it just could be the deflection of a word or a sound or the way you have a lot of saliva in your mouth because you're excited. So we do this because we don't know when we're going to spit and we don't know who could be carrying the virus and who couldn't. So that's the purpose of the cloth mask. So one of the things that the CDC did a great job of outlining is the states that have been really affected. So as of Friday, the well, most people know different states that have open, but one of the things that they're seeing in all 50 states is that there's an increase. There's an increase in the virus, and because travel increases your chances of getting infected and spreading the virus, staying at home is still the best way to protect yourself and others from getting sick. So Texas looks like they have had a spike, especially during the protesting and using gas during protesting, because the tear gas makes you cough. It makes you take your mask off and cough. So by means, when you're out there protesting, please be safe. Please wear a mask if you are going to do that. Florida is being hit very high. A 7-day average of new cases per the Hopkins data is showing that they've had a 7-day high. It says a small part of the increase was testing, but it truly is real cases. That rise could also be exacerbated by people not wearing masks or social distancing, especially on the beach area, and by the use of tear gas at the recent protests. The use of these gases is very serious because it damages the airways, and it can also damage your natural ability to fight off the virus once the tear gas is there, to be able to fend the virus off. Let's see. Another state that's opening, seeing a spike is in Arizona. They hit 79% of intensive care hospital beds in the use of in use on Tuesday, while the use of ventilators rose to an all-time high of 38% on Wednesday. So remember how this all started. The hospitals didn't have the ability to offset the COVID-19 cases, and then began to be overran and under-resourced. So that really hasn't changed. We don't have more doctors. We don't have more resources per se. So we have to remember that this is really a systemic problem, because if we don't have enough resources, we don't have enough even prevention right now, because we don't have a vaccine to prevent it. So the cases are not just going to disappear. COVID, as much as I pray and I'm a believer and I believe the miracle of God that it can disappear just as quick as it came, we have to still be awake and aware that it's still here, and we must protect ourselves. Okay, so in Arizona, they noted that they've had a surge of beds that were already set aside, so they're prepared. And that's a big difference too. When COVID-19 or coronavirus hit, we weren't prepared. Now we know what it looks like. We know how to test it. Our testing is quicker. We know we may need to keep a certain number of beds aside. We know now before anybody goes in to see their doctor, they have to get tested or screened for the COVID. So we're a little bit more prepared for it, but that again does not mean that it goes away. Angela White just chimed in. She's my sister in love. She says, I wear my mask everywhere, and so does my husband. Thank you for confirming the need to continue. Yes, sis, definitely want to continue, because what I'm feeling is that there's a false sense of reality, because if you haven't been affected by it or your family members haven't been affected by it, you may be thinking it's not real. But take it from a healthcare provider such as myself, we have seen real cases. And luckily, as I always recommend, is to keep your immunity high. I do recommend going outside and getting vitamin D, because we've been in the house for 3 months now, and that can have some very, very severe effects just on your mental health and just on your overall feeling good feeling, because vitamin D gives us light. Vitamin D helps our cells. So it's very important that we do go outside and get some light and build our immunity. So that means eating healthy. That means exercising. That means getting your vitamins, especially zinc and vitamin C. Those things are still very imperative for protecting yourself and building your immunity, because the healthy person, if you are healthy, you may get the virus, and it doesn't mean it's a death sentence. It just simply means that you're going to have a good immune system to fight off the disease and be able to bounce back. But we want to do whatever we can to prevent ourselves from even transmitting the infection, healthy or not healthy. Okay, so in California, Los Angeles hit a near record high in cases, even as the county moves to phase 3 of reopening this Friday, meaning gyms, nail salons, like we talked about. They've already opened museums, day camps, and TV TV production to resume operations. As we know, LA is a big hub for television. So with that, Los Angeles County reported 1,800 new cases on Thursday, the second highest number reported in one day. A news release noted that 600 of those cases were from a backlog of test results. So you always have to look at data very carefully, because when they say that there's been a surge, sometimes that surge isn't necessarily that day. Sometimes it could be because they got all of those tests in, and that's making that number seem high. So you have to look at what day you were tested and what day they resulted. Another thing is to, as we see this surge, like I talked about last week, you really want to determine when you actually, when everything reopened. And then you want to count 14 days to see if you see a spike. Also, I would say if you go out and let's say you didn't wear your mask, right? Because we're not all 100% always doing the right thing at the right time. So let's say you did, and you may have been exposed to someone that you don't know, and you don't know if had the virus. My recommendation would be to isolate yourself as much as possible. Of course, we have to go to work, we have to do those things, but I wouldn't say let's go do a whole family reunion, right? So you have to just be mindful, and that's my goal today, is just to be mindful and be awakened to what can still happen. Angela has another question. How does one determine if a multivitamin is needed? I take a cranberry, grapeseed extract, cod liver oil, vitamin C, calcium, and D. Do I need zinc also? So zinc, I tell people zinc and vitamin C are really good together, immune boosters. But I always tell people to have that in your medicine cabinet, because like once you feel kind of like a tinkle in your throat, or you may feel, how you feel when you're coming down with something, that's when I would recommend adding the zinc. I don't think you need it every day. Most multivitamins have zinc in them, but they just don't have enough zinc in them to help fight off a virus. They have enough to help your normal maintain balance, but they don't have enough when you're coming down with something. So I would say all of the vitamins that you have listed, Angela, are perfect. I wouldn't change any of those. But if you are feeling like you're coming down with something, just add that zinc in there with your vitamin C. It works perfect. Another name, Airborne, is this. Airborne is a zinc and vitamin C combination. Also, Vicam. Vicam is another good one that you can use. So, okay, so Los Angeles, we're talking about Los Angeles. Los Angeles also stated that the mayor of Los Angeles conceded that businesses reopening is making him nervous. These governors, I pray for our leaders every single day, because they are definitely in a tough spot, to keep the economy rolling and then keeping people safe. But as I told you last week, your safety is your responsibility. So it doesn't matter what a governor says or what a leader says. You have to be mindful and educate yourself on what you should and should not do for your family. Okay. The next question is, this comment is so true. The Los Angeles mayor also said, we are still in the biggest medical pandemic of our lives. He said, urging those who participate in protests to quarantine for 14 days and then get a COVID test. I think that's an excellent idea, because right now with the climate of America, we kind of toed a line where we want to go out and protest Black Lives Matter and the brutality of the police department across the nation. And it's a very good movement that I see going on, but you have to weigh in on even doing that, because you see from the protests that are televised, people are in very close proximity to one another. And there are some people wearing their masks and there's some people that are not. So if I was someone that had a chronic health condition such as asthma or heart disease or diabetes or any chronic condition, I would not be going out to protest. There's multiple ways that you can show your alliance or you can show your support without protesting. We have enough young, healthy people that can go out and protest on our behalf. But I would just caution those young people that are doing it, and even older people, I'm not saying that. to when you do come back from those protests is taking a couple days if you're able to isolate, just to make sure you don't develop symptoms. And if you're feeling anything, if you're feeling a cough, if you have a fever greater than 102, if you feel like nauseous, muscle aches, body aches, go get a COVID test. Just Google COVID test, local COVID testing. Where can I get it done? And it will point you in the right area. And then take a test. And then that can, either say, yep, okay, I'm good, or no, I need to stay home, isolate, and quarantine. Okay. I have seen reports that we don't need to clean our grocery products any longer. What do you recommend? So the grocery products, the thing about it is with grocery products is that most times those things that are stocked on the shelves have been there forever. It's not that people are touching them constantly. So the theory is that by the time it gets home to you, if there was a virus on there, it wouldn't last, because you remember the virus can last up to 3 to 5, depending on what type of product it is. And I don't have that information in front of me, but there's a dwelling time or a live time that the virus stays on products. And so really by the time you get it, it's probably not, you don't have to clean it. One thing my husband always does, and if there are any grocery store workers or packers or however people do the shelves, but usually they push everything that hasn't been sold to the front of the shelf. So it may be a good idea to reach to the back of the shelf and grab those products, because they're either haven't been sitting out, or even maybe in the middle, right? So the packer hasn't just packed them. You're not getting the things that have been on the shelf and touched upon other people, and then you're grabbing kind of that middle section to take it home. What I would do is I wouldn't bleach down everything. If anything, I would just probably keep it, if you don't need it to use it right away, just keep it outside, like keep it in your garage or keep it in the area, because it'll die. It's not going to just live. It needs a living porous like us to stay alive. So the virus dies on an innate object a lot quicker than it lasts in our body. I hope that answers your question. And I can imagine you get tired of bleaching everything down. So definitely, and really the only time you really need to use bleach in the case of this COVID-19 is if you've had people over, or like if you work in a office or somewhere where there's a lot of traffic flow and you need to make sure you disinfect. But if you're at home and your children are at home and you guys haven't really gone out, you don't need to constantly disinfect your house, because that is kind of like your safe bubble. So I would say, as far as the bleach use, and even people that, we were talking earlier that people are starting to have to go back to work as businesses reopen. So with that, it's very important that you are protecting yourself when you're coming home. So when you're coming home, you want to me and my husband are both essential workers. So we just have like a little area that we just drop all of our clothes, our shoes, and everything off before we come in. And then we wash our hands and we put on regular shorts that are clean in our house. And we don't scrub our bodies down before we interact. We just take off the clothes that we had and make sure they're in the washroom. So that's really the extent that you have to do, because like I said, it's going to be transmitted through your oral membranes, like your mouth, your nose, your eyes, your fingertips. So if you're washing your hands regularly and you're using hand sanitizer, then you're A-okay. But if you work in an area where you have traffic of unknown visibility of where they've been, then that's the time that you would use your bleach. So save your bleach for actual accidents or actual known exposure. Okay? Great questions this evening. I love the interaction. Please like, share, or comment if you are watching tonight, because that helps just bring awareness to a situation that I feel like is starting to be overshadowed by what's going on in our racial injustice that's happening in the world today. And I just don't want it to get lost in translation or lost in importance, that COVID-19 does still exist and that we do need to still protect ourselves and be wise about our interactions. I have a great friend, most of the She Is Still Dope Society knows of Lisa, who passed away in Harrisburg from COVID-19, and she was young. She was in her 50s, and rumor has it, she kind of was going on with life as usual because she's amazing, but we still have to protect ourselves. I know for me, I wanted to go to church on Sunday because I love church, but even in that, our church has done an amazing job of making sure that we practice good social distancing. There's only a certain number of people that can be in the store at one time, and we all had to wear masks, and there was hand sanitizer everywhere. And so I would like to say, you're welcome, Angela. Thank you for your comment. I would like to say that it's important to get out. Okay, it may not be running to the nail shop or the hair shop if you don't need it. I still will weigh your needs and wants very cautiously, and I still would say if you can connect with people either virtually or if you could connect with people one-on-one, and not big groups, I would still say that's the way to go. The summer season, we do usually see a decline in just the way the virus lives, because viruses don't really like warm climates, but it's still here. And we have to get ready to prepare for our flu season. And if you remember, our flu season is in September, October timeframe. And so right when we get through the summer, we're going to have to prepare for the flu. Now, I know there's many people that will be skeptical going into the flu season regarding getting a flu shot. I am a supporter of immunizations. I believe the concept of immunizations and the science behind immunizations are important. So I would recommend to get with the consult of your own doctor, your own personal doctor. But I would say that you would definitely want to get the flu shot, because the flu shot has been around for decades and it's known and studied and proven to reduce your chances of flu. Does it say, oh, you won't get the flu? No, but it drastically decreases your chances of getting the flu. As far as the vaccination for COVID-19, I'm not a epidemiologist. I'm not a public health. My background is not in public health. But I would say, just from a medical perspective, usually before we recommend any type of medications or treatment, we like to wait until it's been studied. And so I might wait until it's been studied a little bit more to get that. Will droplets transfer from your shoes if you don't remove them when you enter your house? Always wonder, so I take them off. I think it's just a good idea, period, to take shoes off. I think our Asian sisters and brothers have definitely mirrored an example for us. Not a lot. There's so many things you can bring in with your shoes. So I think it's just a good practice to keep your shoes outside, because besides even corona, there's just so much bacteria that you can pass and bring into your home with the bottom of your shoes. And so just on a personal note, I think it's important to leave your shoes at the door and maybe have flip-flops or something like that. Because think about carpet. If you have carpet in your house and you're wearing the same shoes that you wear outside, then if you're not cleaning your carpet every day with carpet cleaner, then that bacteria just sits in your carpet. And if you have kids like my kids that roll around on the ground, and I just think it's a lot. It's better to take off your shoes before you come in the house. Yes, our grandparents, listen, they paved the way. Okay, they paved the way. They didn't have a medical degree, but they were definitely wise in every way. And so, yes, you better take them shoes off before you come in my house. Yes, I can hear all the grandmoms saying that. So yes, I just think, taking your shoes off, even from a medical perspective, is a good habit. So let's go back to the basics, right? So back to the basics. We talked about dress before, how to dress for success. I want to kind of reiterate that tonight before I end. And remember, the dress stands for diet. We want to make sure, even through this time, we are preparing for success by controlling our diet. Me and my husband have started a program, and we've lost, I think, maybe 12, 15 pounds collectively. And it really is just a mindset change, just really, wanting to eat from the earth and wanting to do what's right for our bodies. So D is for diet. Remember the R? Anybody remember what the R was? Regular doctor's appointments. So now that we're reopening America, I want you guys to call into your doctor and ask, hey, did I miss any important appointments for our females, for our women? Did I miss my pap smear? Did I miss my annual mammogram? Did I miss getting to the doctor, taking care of my blood pressure? Am I up on all my meds? Call your doctor's office. A lot of doctors are doing these things virtually. Now, you can't get a pap smear virtually yet, but I believe that's coming very soon. So yes, make sure you're getting your regular doctor's appointments. Call your doctor. Just call and check in with them. They're there. They're waiting for you. And a lot of people are thinking, oh, everything's reopening. They're going to be so busy. But we actually are seeing we have been able to kind of mitigate now with the ability to do things virtually a lot better. So access to care has actually improved. So call your doctor for your regular appointments to get into your doctor appointment. The next in Dress for Success is DRE. So E is exercise. You want to make sure you're getting 30 minutes a day of exercise. That could be just a nice casual walk. That could be playing outside with your children. Just get your heart rate up about 150 beats per minute or more, or just walk without stopping for a continuous 30 minutes. Some say break it up, but I think if you, depending on what your goal is, if you want to increase the ability of your heart to function the way it's geared to, you have to challenge it a little bit. So you need to kind of do a consistent 30 minutes because it takes about 20 minutes to enter a fat burning zone for calorie reduction. So 30 minutes is the minimum. If you want to do an hour, go for it. So exercise is really important for you to dress for success. The first S is going to be sleep. You want to make sure you're getting at least 6 to 8 hours of sleep a day. Sleep is an amazing thing that I think we forget about. But when we sleep, we are able to allow our body to heal itself. Our bodies are designed to heal itself. And when we sleep, it's like our body doesn't have to worry about doing anything else. It doesn't have to worry about taking care of standing up straight or digesting food or anything like that. So what it does is all of our cells regenerate, our skin regenerates, our mind regenerates. It's literally a download. So think about it. If you think about the 24 hours that we have in a day, we're up about, let's say you get up at 6 a.m., okay? 6 a.m. to let's say 6 p.m. You're actually doing things. You're working, you're hustling, you're going about your daily things. Your body's doing whatever. So if we're up for 12 hours and we only sleep for 3 hours and we want our body to regenerate the 12 hours that we just plugged in, whose body is going to work more efficiently? The person that gets 6 to 8 hours or the person that gets 3 to 4 hours? So maybe that's how you can think about it when you're like, oh, I can push it. So get at least 6 to 8 hours of sleep. And then the last S is stress reduction. So this is a big one, okay? And this is the one I want to end on tonight. We have to be able to navigate our stress. And I just want anybody that is listening tonight to let you know that it is okay. It is okay to say no. It is okay to stop looking at social media, the news, or anything that is causing you to be moved to a point that is not towards peace. Okay? It is okay to not live up to the Joneses or whatever you're seeing on your social media. And more importantly, it is okay to say, I need help. It is okay to call for the suicide line that's open 24 hours. It is okay to reach out to a friend and say, I'm not okay. And it is okay to not be okay. So what I want to end this talk on is that stress will kill you. For our women, it is the #1 silent killer of heart disease. It is preventable. We are able to prevent the amount of stress that we allow inside of our minds and our bodies. And please, if you looked at anything in the last couple of days, the suicide rate has gone up. I don't have the numbers because that wasn't really my topic of conversation, but maybe we can talk about that next week. We can do a whole segment on stress and the importance of reducing your stress because stress does kill. So I want to end tonight with my devotional that I had this morning. It was so impactful that I definitely wanted to share it because, as you know, I believe in mind, body, and spirit. And so holistically, I want to always end with a word from God. And so let me pull it up here. Okay. So the devotion, I don't know if you know about the Passion Translation, but it's another translation on the Bible app. If you have it, it's a really, really good one. But it's called the Passion Translation. And the topic was, I hear his whisper, focus on me today. So this is what I want to end with when you're reducing your stress. Today, instead of getting sucked in to the world around you, stay focused on me. Center your heart in my presence where it can be kept safe from the swirling chaos. Choose me first. If you truly want to hear from me, put down your phone, set aside social media, ignore those emails and texts for a while, and tune into me. Wait for the instructions of heaven. Bless me with your attention. Be more aware of what's happening in you than what's happening around you. When you're tapped into me, you become light in the dark world. You bring peace into arguments. You are able to mend division because you hear my wisdom and compassion. When you can stand outside of the confusion and look at it from the context of peace, you'll know how to pray. And those prayers will be full of power. You'll be able to love the contrary ones because you understand their words and actions stem from things within them that only I can heal. Keep your mind focused on me today. Invite me into every thought and every emotion. So the scripture reference is Colossians 3:2. And the Passion Translation says this: feast on all the treasures of the heavenly realm and fill your thoughts with heavenly realities and not with the distractions of the natural realm. Isn't that good? I don't know. That blessed me today because it brings everything back into what we have to focus on. And even with the prayer protest that just went on for 24 hours, these women were dedicated and committed to seeking God's face on what to do. So as we reopen America, as we go back into our normal quote unquote programming, let's remember to dress for success. Let's remember to take time in the beginning of the morning to focus your thoughts on God, on him, and stay connected to him so that he can direct your path. We know that scripture, Philippians 4, it's Philippians 4, Philippians 3. Okay, don't quote me, but it says to trust in the Lord with all thy mind and lean not on your own understanding, but acknowledge him in all our ways. And that's what we want to do in this season. I can give you all the facts. I can show you all the statistics, but ultimately you have to have the discernment to do what's best for you and your family. So be blessed, stay healthy, stay whole. Please like, share, follow, and subscribe to drrobynwhite.com and sheisstilldope.com. I have some good things coming in the future, so don't miss out. Check me out, Dr. Robyn White and She Is Still Dope Society. Have a phenomenal night. God bless you, and we love you.